Welcome students, welcome to this presentation on asymmetric information and working of the health insurance market. Most medical information is technically very complex and beyond the capacity of ordinary citizens to understand those the complex nature of working of the human body, unless they are of course doctors. For ordinary citizens, what makes it worse is that for many it might be the first time the person is falling ill with a particular disease, or for many others it may be a disease that has not recurred at all. So in these cases, it becomes extremely difficult for individuals to understand the complexity that they are going through. The cost of gaining that information is extremely high, so that is out of bounds for individual citizens to collect these kind of information about the disease. It is also difficult to postpone the treatment because postponement would mean the disease could aggravate or it could result in even death in the extreme case. So the issue of postponing healthcare purchase is not something that we say is easy to perform. On the other hand, we also find that it is impossible, near impossible, for the ill person to scout into different hospitals, meet different physicians, and then take a decision of which doctor and which hospital and what kind of a healthcare intervention the person would require. This is not so in the case of purchases made in the case of, say, consumer durables or other household goods, where we get the time to purchase these goods after seeking information. So in the medical case industry, that is not possible. We don't have so much time to seek the information. This imperfect information has long been regarded as a peculiar character of the health economy. And asymmetrical information exists in this particular system. We know that asymmetric information means that there are two agents who are involved in a particular economic act. Now, here we have the doctor and the patient, and the information that the doctor has is far greater than the information that the patient has. So, there is an imbalance in the sharing of information between the two parties, the doctor and the patient. So this asymmetrical information is a part of this medical care industry. Now, this asymmetric information has not only its implications in the medical care industry but also affects several other activities. So we have a Nobel Prize in 1996 for the working on this asymmetric information, which was given to Sir James Mirrlees and William Spencer Workey, and that was for what are the incentives under asymmetric information. Does it provide any incentive to the person who has more information or to the less information person? Is there some advantage that arises out of it? And that is what was the Nobel Prize of 1996. Yet another Nobel Prize was given in 2001 to George Arthur Akerlof, Michael Spence, and Joseph Stiglitz, and their study was on asymmetric information. Asymmetry, one party having more information than the other. This leads to a new area of study called the information economics revolution. A lot of studies have happened thereafter on information economics. So information gaps exist not only in the medical care industry, appears in the consumer durable industry. The makers of those durables know more than the users of the item. It could be in the job market. The sellers know more, the suppliers of labor know more about their experience than the buyer or the employer of that labor, or the employer knows more about the organization in which a person is going to be absorbed, and so on and so forth. So you can have it in the financial market, you can have it in health, and several more. So it becomes of important in economics because one party may have more advantage in terms of information than the other, and that needs to be exploring because that will not allow the market mechanism to work. That is why we need to understand the working of this asymmetric markets. Let's look at this paper, an interesting paper by George Akerlof of 1970 called Markets for Lemons, Quality, Uncertainty and Market Mechanism. Now, he explained his paper in the context of the used car market. It's available online, you would like to read that. And it's an interesting paper to see how markets for lemon work or markets for used car works. Now he says there are used cars which the owners would like to sell them in the market, and there are potential buyers of these used car. So the sellers of these used car know more about their car which they propose to sell than the potential buyers of that used car. The potential buyers knows that the average quality of all used car is of a perception that all used car has a certain quality, and therefore they treat all used car the same, and they're willing to pay a lower price for used cars than for a new car, which is again understood. So they don't differentiate between a top used car and a low quality used car. For them, all used cars have some problem or the other. That is why they are being sold out. Now, the owners of top used car which are of good quality may not want to sell their good cars in the market because they do not get the expected price of that used car. So, if this kind of a situation continues, then it is quite likely that people may not want to sell used car. So, the market for used car may collapse. So, and it may completely disappear if the sellers want to sell it at a price higher than what the potential buyer is willing to pay. So this market can completely disappear. Now, what you see actually working in the market is to overcome this, you find that there are showroom certified used cars. So there is some kind of a branding that is done, and then the potential buyers may buy it because it has been certified by the company. That is one way in which the used car market's problem has been solved. So the same idea of used car of Akerlof has been applied to the healthcare market. Patients are poorly informed compared to the provider about the nature of illness, the treatment available, the expected outcomes, the prices charged by other providers or competitor. Now, it's unlikely that the seeker of medical care has got all these kind of information. On the other hand, we also have the provider of medical care who may be uncertain about certain procedures. He may not be as informed as the patient about the outcomes of, as uninformed as the patient about the outcomes of the many medical practices. So the doctor may know that certain kinds of treatment may work, but not so sure whether it would work in all probability. So that is something that even doctors have a little bit of a yeah. The Akerlof's paper can be applied to the healthcare market too. The reason being that patients are poorly informed of what? Poorly informed compared to the provider of the healthcare in terms of the nature of illness, in terms of the treatments that are available, in terms of the expected outcomes of the treatment, and the prices charged by the competitors in the industry. So it is impossible for a patient to look for all these information. So the provider of the information certainly has more information than the user of that service. The provider too, the physicians or the hospitals too are uncertain because they may not be as uninformed as the patient, but they too have a certain amount of uncertainty regarding the outcome of certain kinds of treatment that they may want to pursue. So some medical procedures, they may not be so sure as what can be the outcome of it because it is after all life and therefore it has got that amount of uncertainty. Now let's look at the problem of risk and uncertainty. Health future health of a person cannot be predicted with certainty. So we know that health will deteriorate for person. From the Grossman study we can understand that, or Kenneth Arrow's article, we know that health will deteriorate as we go by, but we are not so sure when this would happen and how it would happen. So there are two kinds of problem that it imposes. One is the uncertainty, because it is human life and there is an uncertainty. We do not know what is happening. But on the other hand, we have something which are known and of which we have a risk. We can take a risk. The risk could be that if we drive recklessly on the road, we could meet with an accident. Is a risk. It is known. It can happen. Probability of that happening is more than other things. So risk is something which can be expected. In probability, it can happen. Whereas uncertainty is not related to probability. We do not know what is in store about something. So there are some element of risk in medical care, and there are some, for example, an accident is a risk, whereas old age for a person is certainty. Uncertainty is when does the person and or his illness begin. That is uncertain. In many cases, it might begin much earlier than what is expected. So there are certain kinds of uncertainties in healthcare, but there are also certain kinds of risk in healthcare. And the healthcare is such that it cannot be postponed, because postponing healthcare itself is risky. We saw that in the case of the recent pandemic, when people do not take care of their health and they do not take decision to meet the doctor on time or to get admitted into the hospital on time, we have seen very disastrous consequences of that. So this happens because we can't postpone healthcare. It's not always good to postpone healthcare. The consequences may not be the right one that we expect. Now, how does the medical market respond to this kind of health risk and uncertainty? So, the medical market has developed what is called as the medical insurance market. So, individuals, what we do is we take an insurance policy, and this insurance policy is taken so that individuals can prevent a single event from having a detrimental financial effect on the person's life. Today, we can hear of many families who have lost all that they have had, financial resources or assets, and they are impoverished or they're into poverty. So, once an insurance policy is taken, it is with the attempt that this kind of detrimental effect on financial insecurity need not happen. So, how does this financial insurance, health insurance market function? Health insurance work on the basis of premiums. That means individuals pay premium on the probability of certain events occurring among a pool of people. So, for a pool of people, an age group of people, there are possibilities or the probabilities of certain kind of events occurring according to the studies that have been performed. They know that in particular age or particular gender, these kind of illnesses are likely to happen. Accordingly, the premiums are fixed. So when a member of the insured group suffers any kind of illness, then the insurance company bears a part of the cost of the illness and makes payment for the treatment to the hospitals. This is how the insurance companies work. Unfortunately, this insurance market does not work as efficiently as I said, because there are reasons for markets to fail. So there is a lack of information from the about the illness. There is a lack of information about the outcomes. There is a risk about illness. There is a risk about death and so on. So there are risks and uncertainties involved, and therefore there are incentives to both the provider and the person who is ill to use and misuse this particular information between the two parties. The outcome of this uncertainty and in asymmetrical information is known as moral hazard problem and the problem of adverse selection. Now, what is this moral hazard problem? Once a person insures himself or herself, there is an incentive for the person to behave differently than if he or she was not insured. This is because the insurer, the insurance company, cannot observe the behavior of the insured person. Kenneth Arrow argued in 1963 that medical insurance companies may be reluctant to provide full insurance. What's the reason? Medical insurance companies observe the patterns of doctors and find that it is quite possible that doctors have an incentive. Doctors may get an incentive to behave in such a way to over prescribe treatment, even if they are risky and they are not certain of the intervention to work, because anyway, the cost of the treatment will be borne by the insurance companies. So Kenneth Arrow made this striking information that doctors may also tend to overprescribe treatments. The other thing is that once a person has insured himself or herself, they have an incentive not to follow healthy lifestyle. They may not get their preventive checkups done, and they have a tendency, because anyway they have insured their life, and if they fall ill because of these things, they would be taken care by the insurance company in terms of financial commitment. They have also a tendency to over consume healthcare. They feel that anyway the medical insurance is there, therefore if they fall sick it can be taken care of. So even for very small kind of illness they have a tendency to seek insurance payment. So if left to themselves, there are many kinds of disease, many kind of illness, small kinds of illness for which they may not seek medical insurance. But because they have insured, there's a tendency for them to ask for those treatment. If they had to do it on their own, they would not have possibly taken that. This results in something very unique in sense that the insurance companies have to give out a large amount of money to pay out insurance for these kind of ill persons. And then that the payment that the insurance companies have to do is very large. And insurance companies face a peculiar dilemma how to handle these kind of people who do not take care of themselves when they have fallen sick, or there is a moral hazard in these people not behaving according to the expectations of the medical insurance company. So the market itself may collapse, the insurance companies may not be willing to give insurance to people. What's the solution to this moral hazard? So we know that this is quite likely that because a person is insured, he or she may not want to take care of their health and want to claim for every event that happens. They may want to claim from the insurance company. And what the medical insurance companies have overcome with, they have deductibles. These are terms that you will find that in a medical insurance policy purpose, you will find these terms. Deductibles, that is the amount a policy holder may have to pay out of their own pocket before the insurance actually starts paying. So before the company starts paying for the very day-to-day requirements in the hospital, the person may have to pay, which is called deductible. Then patients are made to pay a share of the cost. So part of the cost itself has to be paid by the individual, which is called as co-payment. Also, we understand co-insurance. Insurance companies cover only a certain portion of the cost of the total treatment. Say 80% will be paid by the insurance company and 20% may be paid by the individual. And also, the reason for doing these kind of things is that individuals do not seek medical insurance claims just because a person has insured, and this will prevent them from seeking these, because only unless a person has spent a certain amount of money, the insurance companies don't come into action. The other way that the medical insurance companies have found out is to make claims very difficult. So the procedures of claiming insurance payment becomes difficult. So people think times whether they need to seek these medical insurance payments. We also find that medical insurance companies may give free checkup to people who are insured so that individuals are motivated to take care of their health and they prevent any kind of illness even before the illness occurs. In which case, the medical insurance, by paying a small money in terms of free checkup, actually prevent a lot of resources that they need to spend if the person actually falls sick. There is another peculiar problem which is called as adverse selection. In the case of adverse selection, what happens is the insuring company can make a mistake about selecting wrong people to provide insurance. But there are two parties here: the insurance company and the insured individual or policyholder. This insured person may not have provided all the necessary details to the insurance company. So insurance company may have insured a person not fully knowing about the quality of health of that insured person. So individuals in this way are able to purchase health insurance at rates which are much lower than the risk that that person actually entails, plus the loading charges or the cost of the insurance company. Now, insurance company will not have this complete information, and in which case they'll end up paying much more when the person is sick, because they did not know that this person was actually potential person with this kind of illness. So individuals in poor health will, by in general, will have a more they have a greater tendency or a greater incentive to seek medical insurance than young people or healthy people. So there are two kinds of people in the insurance market now. So there are these healthy people, the people who do not have any health issues, and there are the people with less health conditions, and they are the ones who seek more of health insurance. Now, what can happen when you have two kinds of people in the market? It is quite likely that the insurance company will be registering only the more unhealthy people, and the healthy people will move out from the market. In which case, the insurance company will collapse, because the insurance company will have to pay only collect insurance only from the unhealthy people and pay out only to the unhealthy people. So the amount that it has to pay becomes very huge. So the payment that has to be paid, or higher payouts have to be made by the insurance company. So the insurer's interest is what? Now the insurer is interested in something. The insurer would like to do away with these high risk customers. People who are more likely to be risky, they want to do away with them because they want to have lesser payout made. So either exclude these likely sick people, or compensate that by charging them higher premium. This is why you find that there are premium charges for different kind of people in health insurance. Now, what happens with higher premium? When higher premiums are charged flat on all people, then many people will not like to take insurance. So it discourages healthy individuals from purchasing health insurance. Again, the health insurance for the risky people will continue, whereas the health insurance for the less risky people will collapse. So only the ill will buy insurance, leading to losses for the insurance companies, and eventually this will lead to the collapse of this market as well. So moral hazard and adverse selection explains why a free market for health sector will not actually work. So moral hazard is when a person is and taking up activities that can be against the insurer's interest, and adverse selection is not giving adequate information to the insurer, and therefore taking advantage of the premium. So both these will result in the insurance companies collapsing, because the insurance companies have to pay out a huge amount of money. So, what's the solution to this? The solution is everybody buys insurance. The healthy and the unhealthy people buy insurance, so that the insurance company has a large pool of risk, pool of sharing of the risk. So, when both the healthy and the poor people pay, then on an average the risk is lower than the risk from recovering only when they are ill. So a large number of people may not fall ill at all during that period of insurance. Only some people will fall ill, and that can be covered by the insurance company. The other solution that insurance companies find is to charge different premiums according to the risk level. So they anticipate to know the risk levels of the individuals and thereby charge different premiums for different people. But then the cost of collecting this information is also quite expensive, and still there are many who would get in without paying the appropriate premium they should have been paying. So we saw that the medical insurance market, though, is a solution to provide healthcare, which is a very costly expenditure for families. But then we also see that there is a problem of medical insurance getting through the problem of moral hazard or through the problem of adverse selection, which is a problem of asymmetric information. Now, how do we get out of this situation where the market for health insurance does not collapse? So what they do is we talk about the role of government in asymmetrical information. So whenever there is a new disease that occur, the government has to compensate for that information failure. In which case, the government has to tell the insurance companies as well as the people what is the nature of the illness, what is likely to happen to this illness, what is the nature of cure that is expected, and so on and so forth. So once this is known to both the parties, then both the parties can decide on the kind of insurance they've taken. You must have seen that now during the COVID time, the premiums for all kinds of policies have gone up because the risk of many people getting infected, the disease is very high, and the cost of treatment also appears to be high. So the medical insurance companies, what they have done is they have raised the premium so that they can pay out if claims come to them. So the government's responsibility here is to provide information to citizens so that individuals can take care of themselves, they can reduce them falling ill, they can reduce their ignorance about the disease. That is why on a daily basis we find newspapers and TV reports coming and telling us that what is the number of occurrences that have happened, what are the number of cases that are in hospitals, what is the number of cases on ICUs and ventilators, and what is the positivity rate, and a whole range of information that the government is releasing on a day-to-day basis so that individuals can protect themselves from falling ill. Now that is the job of the government, to reduce asymmetrical information between the buyer of insurance and the seller of insurance. Then the other thing that the government can do is to support the medical research on the area of disease whenever it occurs, so that it increases the pool of knowledge among the physician. We know that when the disease occurred for the first time, how even doctors were unaware of what is the kind of right treatment that is necessary for this illness, and they were trying different methods of illness. It is only after the research that was painstakingly done to find out which medicines work, which treatment works, that we have been able to deal with the diseases better than what it was in the earlier. So that is the function of the government, to provide this medical information, medical research information, so that that information enters into the pool of knowledge of the society, and thereby the risk of the insurers are also reduced, and the risk of the citizens are also reduced, because there is more information that they can share. Now let us see how the government and health insurance works. The health sector is one of the important social sectors, and it has got major economic implications. By now, we have seen what is the economic implication of people falling ill. We have seen the economic implications of lockdown. We have seen the loss of jobs. We have seen the loss of incomes, the increasing number of people falling into debt. All of these are outcomes of poor health, and therefore the government cannot think of ignoring health as an important element which affect all sectors of society. So market for healthcare, we know it can collapse, insurance sector can collapse, and therefore government intervention is important. And therefore the government provides through subsidies and public provision of healthcare. That is why again we are seeing government hospitals have ramped up the testing. Private hospitals may not do so much testing as the government hospital. Individuals are not willing to go to the private hospital to get themselves tested. Therefore, it becomes mandatory for the government to provide the testing. Again, you have seen that in the vaccination market, it becomes mandatory for the government to do more of the vaccination than the private sector, because individuals may not opt for paying for the vaccination themselves. So these are the very complicated scenarios that we can see in the health market. So we see that in most countries of the world, government plays a major role in the providing of financing the health. The reason is simple. If we have a large number of poor people who do not have medical access, they are likely to fall sick. Their likely falling sick is not the only problem for the society. Their likely problem, those who don't access medical care, they also have externalities, which means others fall sick because some people fall sick and they have not taken medical care. It becomes mandatory for the government to ensure that everybody has got health protection from the disease, the pandemic that we have seen. How the government has tried to cover everybody with vaccination, or trying to test, or making containment zones and lockdowns and all of that, because one area where it is sick, it can affect large number of areas. The implications are too severe to be ignored. The government has got plans for healthcare. Not now, it's a very old plan. We have the state health insurance policy, then we have the ESI, we have the central government health policies. There are so many policies. Each state has got its own set of policies. We have around 15 such plans in India, and now there is the talk of the universal health coverage. That means until everybody is covered by health insurance, the insurance companies themselves may not be willing to provide insurance. It becomes very risky for them. And there is a way now the private sector has been involved with insurance, where there is compulsory insurance financed through taxes. That is one. The other one is through the employer, the employee contribution. So employers and employees and also contribute to the insurance of the employees, by which way an employee working in an organization has got a pool of other colleagues, and all the employees together, when they take insurance, it works for the insurance company to provide it to the workers in that particular organization. So that is how the private sector insurance companies are working with the private sector. The government works with the government sector, and then for the public there is the health that is provided through the various government schemes and through the various government hospitals and primary health centers. However, government is also not very successful in providing healthcare to its people. There are innumerable problems where the markets fail, and the governments can also fail, like administrative problems. There could be political problems, there could be technical problems. There are a variety of problems that can occur even when the government is providing healthcare. So the question is, what happens when the markets fail and the governments fail? So we have seen that happening during the pandemic, and we have seen how the non-governmental organizations or the charitable organizations, they also enter into healthcare. They have been involved with providing testing facilities. They have been providing more so with vaccination facilities. So these are the ways that this medical insurance market works, and there is an attempt to make that everybody who requires healthcare are also provided healthcare by any of the agencies. But insurance is an important activity for individuals to get their health insured, so that they can prevent financial distress that diseases can entail. And many of the diseases are very expensive, and today hospitals working in the imperfect market are also very expensive for treatment. Therefore, it becomes mandatory for individuals to seek medical insurance. So, thank you very much. Please do subscribe to the channel if you have not subscribed. I hope you have liked this channel. Thank you.